Living with paranoia, a struggle between fear and reality. Paranoia is a distressing and often debilitating condition that distorts a person's perception of reality, making them feel constantly threatened, watched, or conspired against. While it is commonly associated with mental health conditions such as schizophrenia, anxiety disorders, and paranoid personality disorder, paranoia can also affect individuals experiencing extreme stress, trauma, or even substance abuse. Living with paranoia is a difficult and isolating experience, as it creates a persistent state of fear that shapes a person's daily interactions, decision-making, and overall quality of life. The nature of paranoia. Paranoia is more than just occasional suspicion. It is a deep-rooted belief that others are plotting harm or deceit, despite a lack of clear evidence. These thoughts can manifest in various ways, from mild distrust of strangers to extreme delusions involving government surveillance or personal persecution. Paranoia can be triggered by multiple factors, including past trauma, unresolved fears, or even genetic predispositions. The mind, once caught in the grip of paranoia, finds it difficult to separate rational concerns from irrational fears, leading to overwhelming distress. The emotional toll of paranoia. One of the most challenging aspects of living with paranoia is the emotional burden it imposes. Constant fear and hypervigilance lead to heightened stress levels, which in turn can cause physical symptoms such as insomnia, rapid heartbeat, and chronic fatigue. The inability to trust others often results in social withdrawal, making it difficult to maintain friendships, relationships, or even professional connections. Over time, this isolation reinforces paranoid thoughts, creating a vicious cycle where loneliness amplifies fear, and fear further deepens loneliness. For those experiencing paranoia, everyday situations can feel like a minefield of potential threats. A simple glance from a passerby might be interpreted as an act of hostility. A colleague's private conversation may seem like a deliberate conspiracy. These irrational thoughts, though seemingly real to the individual, make normal social interactions almost unbearable. As a result, many people living with paranoia struggle with feelings of alienation, depression, and, in extreme cases, suicidal thoughts. The impact on daily life. Paranoia affects multiple aspects of daily life, from simple routines to significant life decisions. Many individuals suffering from paranoia develop coping mechanisms that can further isolate them, such as avoiding crowded places, refusing to answer phone calls, or obsessively checking locks and surveillance cameras. In some cases, paranoia can lead to dangerous behaviors, such as confronting perceived enemies or engaging in self-destructive acts to escape perceived threats. At work, paranoia can make it difficult to function in a team setting, as the individual may feel scrutinized or targeted by colleagues and supervisors. This can lead to job instability or unemployment, further exacerbating feelings of helplessness. In personal relationships, paranoia often breeds mistrust and accusations, which can push loved ones away, leaving the individual with fewer sources of support. Coping with paranoia. Despite its challenges, paranoia can be managed with the right approach. Professional therapy, particularly cognitive behavioral therapy, CBT, helps individuals recognize irrational thought patterns and develop healthier ways of interpreting their environment. Medication, such as antipsychotics or anti-anxiety drugs, may also be prescribed in severe cases to help stabilize emotions and reduce distressing thoughts. Beyond professional help, lifestyle changes can play a crucial role in managing paranoia. Engaging in mindfulness techniques, meditation, and relaxation exercises can help ground a person in the present moment, reducing the tendency to overanalyze situations. Establishing a strong support system of trusted friends, family, or support groups can also provide reassurance and combat feelings of isolation. Another important step in coping with paranoia is self-awareness. Recognizing paranoid thoughts as symptoms rather than absolute truths can help individuals regain control over their perception of reality. Keeping a journal to track paranoid episodes and their triggers can provide insight into patterns and help in finding ways to mitigate distress. Conclusion. Living with paranoia is a constant struggle between fear and reality, where the mind is trapped in a cycle of suspicion and distress. The emotional toll, social isolation, and daily challenges that come with paranoia can make life incredibly difficult. But with the right support and treatment, individuals can learn to manage their symptoms and regain a sense of stability. Though paranoia may not be entirely curable in some cases, understanding and addressing it can pave the way for a healthier, more fulfilling life.